Your thyroid function can play a part in your body's weight and weight loss goals. Hyperthyroidism, an overactive thyroid, occurs when your thyroid gland produces too much of the hormone tyrosine. Hyperthyroidism can accelerate your body's metabolism, causing unintentional weight loss and a rapid or irregular heartbeat. On the other hand, hypothyroidism slows down your metabolism, making it more difficult to lose extra weight and to maintain a healthy body weight. In general, 5 to 10 pounds of body weight may be attributable to the thyroid depending on the severity of the hypothyroidism. Finally, if weight gain is the only symptom of hypothyroidism that's present, it's likely that the weight gain is solely due to the thyroid. There's many symptoms of an underactive thyroid, such as tiredness, being sensitive to cold, weight gain, constipation, depression, slow movements and thoughts, muscle aches and weakness, muscle cramps, dry and scaly itching, brittle hair and nails, loss of libido, pain, numbness and a tingling sensation in the hands and fingers, and irregular periods or heavy periods. Thyroid problems sometimes start as a result of poor diet, stress, missing nutrients, or toxins. Changing your diet and taking herbal supplements are two ways that you can help to improve your thyroid function. According to the National Institute of Health, selenium is a trace element that plays a part in the thyroid hormone metabolism. 3 Brazil nuts per day supply the required dose of selenium. Alternatively, a daily supplement containing 200 micrograms of selenium will suffice. Sugar and processed foods can lead to increased inflammation in the body. Inflammation can slow down the conversion of T4 and T3 thyroid hormones. This can make your symptoms and thyroid disease worsen. D-ribose is the only sugar that, instead of raising blood sugar, actually reduces it. It also helps to treat symptoms such as chronic fatigue, which can occur from an underactive thyroid, so it may be a beneficial supplement here. Common doses of this are 5 grams or 1 teaspoon taken 3 times per day. Low thyroid hormones can affect your body's vitamin B12 level. Taking a vitamin B12 supplement may help to repair some of the damage that hypothyroidism has caused. Take B12 in the form of methylcobalamin. It can help with tiredness that thyroid disease can cause. You could check out my video on the MTHFR polymorphism to see if you're an undermethylator and require higher doses of B vitamins. The NIH studied the link between hypothyroidism and small intestinal problems. It was found that altered gastrointestinal mobility, commonly seen with hypothyroidism, can cause small intestinal bacterial overgrowth and ultimately lead to chronic gastrointestinal symptoms such as diarrhea. Probiotic supplements containing live, helpful bacteria can help to keep the stomach and the intestines healthy. Fucus vesculosus, alternatively known as bladderwrack seaweed, is the herb most commonly associated with the treatment of hypothyroid. This is a kelp and a seaweed product that's often used for hypothyroidism due to the high iodine content. However, nascent iodine is the form of iodine that I would recommend. Although it's more expensive, it's close to the natural form of iodine that your body uses. A lack of iodine can make it difficult to properly detoxify the body. It can create thyroid dysfunction and promote cancer cell growth. Centella asiatica, or Gotu Kola, is a great adaptogenic herb, and it supports brain health, nerves and mood. It's considered one of the safer adaptogenic herbs, and it's generally well tolerated by patients. One of the most common subjective symptoms that hypothyroid patients report is brain fog. The Gotu Kola herbal formula can help to support the cognitive function. However, on its own, this herb is not sufficient to treat hypothyroidism. Tyrosine helps to make several important substances, including dopamine. The dopamine regulates your reward and pleasure centers. This important brain chemical is also important for memory and motor skills. It makes adrenaline and noradrenaline. These hormones are responsible for fight or flight response to stressful situations, and it makes thyroid hormones responsible for regulating your metabolism. In clinical trials, supplementing with ashwagandha for 8 weeks essentially worked as thyroxine treatment, helping the hypothyroidism patients to significantly increase the thyroxine hormone levels and thus reduce the severity of the disorder. Essential fatty acids found in fish are critical for brain and thyroid function. DHA and EPA, omega-3s, found in fish oil are associated with a lower risk of thyroid symptoms, including anxiety, depression, high cholesterol, inflammatory bowel disease, arthritis, diabetes, and a weakened immune system. Some things to be avoided. If you're suffering from hypothyroidism, don't use lemon balm. There's a concern that lemon balm may change the thyroid function, reducing thyroid hormone levels and interfering with thyroid hormone replacement therapy. And goitrogen foods. People with hypothyroidism may want to stay away from eating large amounts of raw brassica vegetables like broccoli, cauliflower, cabbage, kale, soy, and Brussels sprouts. You can visit my website for videos on the specific herbs and supplements mentioned in this presentation for more information.